Well, I said on the day that we released the findings of that report that this thing had tremendous momentum, and that, if you go from, a few hundred deaths in 2009 to 1,400, 1,200 in 2014, depending upon how you do the math. I mean, you're working with a line that's going like this. So in the short term, what you're really trying to do is just break the momentum of that line. And that's through a whole series of initiatives, some of which we can do right away and some of which we're going to need legislative help on. But the stuff we can do right away, we're going to start appointing people to the Board of Registration of Medicine, the Nursing Board, the dental board who have addiction and pain management experience. We're going to incorporate CMEs and CEUs into the in-service curriculum for people who are practitioners around addiction and pain management. We're also talking to the medical schools about why you can get through medical school and get a degree with 1 or 2 hours of education on addiction, which doesn't really seem to make a heck of a lot of sense. So there's a whole bunch of things on what I would call the intervention and prevention end of this that we're chasing right now. We're also incorporating a sort of a curriculum and a set of guidelines for school nurses, holding a couple of conferences with them to give them sort of the best guidance on how to identify addiction issues, how to talk to kids about them. We're also, if we get this up, which I believe we will sometime in September from the legislature, we're going to put together a curriculum for middle school and high school for kids and parents and teachers. We're also chasing a series of initiatives around the expansion of insurance coverage, which starts in October for detox, and a number of our pill take-back programs are starting right after Labor Day. So, I mean, there's a bunch of stuff we're just going to start doing. We also have a series of initiatives that are in that SUP around expanding treatment and recovery. We're also going to certify sober houses. We're opening up the last recovery high school this fall. I mean, there's a lot going on here, but my expectation is, whether you're talking prevention, intervention, treatment, or recovery, this is going to be the kind of thing where the real goal here in the short term is to try to take some of the run rate out of it, because I've said it twice, the momentum on this thing is unbelievable, and to break the momentum and then try to see if we can't start moving in the right direction. Yeah, Mary Lou's interviewing people right now, and hopefully we'll, at some point in the not too distant future, it'll depend, obviously. We had somebody in mind, they took a different job, but there's going to be kind of an assistant secretary for addiction working in the secretary's office at Health and Human Services, because you got Mass Health, DMH, Public Health, just a bunch of different entities that all have a piece of this sitting inside that secretariat, so the assistant secretary can manage down but can also manage across to the Secretary of Public Safety and some of the other folks across. Well, part of the money that's in the SUP that we filed is designed to increase the reimbursement rates for folks on the public side. The Mass Health piece, I mean, the funny thing about the Mass Health thing is I do a radio show once a month on Jim and Marjorie on GBH, and the last time I was on, a couple of people called and said that, it was too bad that Mass Health didn't cover substance abuse treatment. And I said, actually, covers a lot of it, including a lot of the outpatient stuff too. So, I mean, I think some of this is, there's mythology, there's reality, and we need to do a better job of making clear to people what reality is, especially if reality is an answer that can help and support people. But we should all remember that the legislation that got passed in 2014 and signed by Governor Patrick actually increases the authorized length of stay for somebody in detox and private insurance to 14 days. It's either 14 or 21, I can't remember what the minimum is. Which I think is going to change that dramatically as well. And there are a series of beds opening up all over the Commonwealth over the course of the next 18 months. I think we'll probably add somewhere between 200 and 300 beds. Just the stuff I know is coming. There will be other beds additionally. I wouldn't be surprised if by the time you get out a couple years from now, there'll probably be 400 beds.
Our private
I'm sort of a local government guy on a lot of this stuff. And as I said at the time when it was first proposed, that I don't think there's a silver bullet on any of this. And if Gloucester wants to pursue a different path than some other people do, let's see what happens, and other people can learn from that. The chiefs of police meet once a month. I have to believe that, as a group, I have to believe that if I see him today when I'm up there, I'll ask him, but I have to believe that at some point he's going to make a presentation to his colleagues about how this is working and how it's going, and they'll have plenty of opportunity if they want to pursue something like that on their own to do so. But I really, some of this is uncharted territory. There's some tension between the folks on the on the law. I mean, there's tension within the law enforcement community about this generally, because sometimes it's hard to separate a dealer from an addict, and I certainly want to see us continue to prosecute dealers and traffickers. And I think and there's a lot of different approaches to this. I think in Plymouth County, the DA brought manslaughter charges against a dealer down there, and it'll be very interesting to see what happens on that. If he can actually make that charge stick, I think that has some interesting consequences for the tools in the toolkit for law enforcement generally. And I do think the more we can do to separate what I would call the user community from the trafficking community and think about them differently, which I happen to believe is happening already, the better off we're going to be.